What's up, guys? My name's Dr. Pham. I'm a board certified dermatologist in PharmD, and I've been seeing some real hype about microneedling for hair loss. This is a treatment that's been around for a while, but it's slowly picking up steam for the past few years. And I was a bit of a skeptic, to be honest, because for me, if something's too good to be true, it probably is. But like always, I poked around in the literature to see what I could find and to see if there's any merit to this madness. Why? Because science, y'all! Does microneedling work for hair loss? Well, let's find out. Okay, so let's get a little bit of background on microneedling. So over the past few decades, microneedling has been rapidly evolving in treatment of various things in dermatology. The concept of microneedling was described around the 1900s. The idea was to harness our skin's wound healing response and taking advantage of its ability to produce growth factors and other healing signals to generate new collagen, blood vessels, and stimulate cellular regeneration. As we've refined technique and devices have gotten so much better over the years, microneedling is now widely used to treat fine wrinkles, scars, melasma or other discolorations, skin rejuvenation with great success. Many studies involving microneedling and alopecia have been done with some promising results. We'll go through some of them in a minute. And watch until the very end, and I'll talk to you about some of my suggestions if you were interested in trying this at home. Next, let's talk about the types of microneedling tools that are available. So there are the at-home Dermarollers, which is manually rolled across the scalp. The advantage of this is it's cheap, it's readily available, and can be done at home. Generally, it's very well tolerated if done correctly. The disadvantage with manual Dermarollers is that the needles dull very quickly. There are concerns about sterile technique and storage, as well as user dependency, which will lead to variations in depth of penetration from inconsistent pressure as you roll. Also, it can cause damage to the hair because as the needle rolls at various angles, it can cut into the skin and could potentially cut and damage existing hairs. It's like a lawn dethatcher. You're gonna damage grass as you go. And like I said, the angle of penetration varies because of the natural curvature of the scalp, as well as the way that you have to angle your hands to get to little nooks and crannies. It could damage or tear the skin. The next tool that's available are stamping devices, and these look like tiny little stamps with the needles. With this, you can likely get more consistent depth of penetration, but the thing is, it's very small, and when you do it manually, it may be very difficult to be accurate where you previously stamped, and you could lose track of what you've done, and it would probably take a really long time if there's a large surface area to treat. The other problem is, if you stamp over and over in one spot, it can lead to damage and scarring. Now, same with the Dermaroller. These devices, their needles dull very quickly as well, especially on thicker skin. Even when I'm doing Botox injections on the face, I do frequently have to change the syringes because, again, they dull very quickly. The needles get bent, and it can be very painful as it goes into the skin and potentially could tear the skin. The other device that's available is done in office, and it's called a microneedling pen. These are medical grade devices which deliver consistent depth and control. There isn't an issue with sterility because the little needle attachment heads are discarded after every use. The advantage, obviously, is someone trained to do this is doing it for you. The only disadvantage really is the out-of-pocket cost for the treatment, as it's generally not covered under insurance. Now that we know a little bit about the background of microneedling, let's look at some of the evidence for its use in hair loss. The first one I want to talk about is a rat study that was done just to talk about the concept of hair regeneration. So they took some mice and got rid of their hairs on their backs. They then microneedled their bare little backs with different needle lengths from 0.15 millimeters to 1 millimeter. And they compared the results to control group that had their backs rolled without needles, aka a little mouse massage. After 3 weeks, They saw more hair growth in the test group than the control group. And on a molecular level, they demonstrated that there was upregulation of several different signals important for hair growth and follicular regeneration compared to controls. That is the Wnt signaling and beta-catenin. These signals are extremely important in cellular proliferation and differentiation. So that's very interesting. Now let's look at some human studies. Since there are actually so many, I'm gonna pick some of the better ones that are available and try to bang through some of these highlights. I will be honest, after reviewing all of them, they are of lower quality, but that doesn't mean it's completely useless. Let's go through them and see what they found. So the first study we're gonna look at was published in 2013, one of the first studies ever published on microneedling for androgenetic alopecia. What they did was they excluded patients who were previously on anti-androgens such as finasteride or dutasteride, and they had 94 patients with androgenetic alopecia. They split them up into two groups, one getting minoxidil and the other with minoxidil and microneedling. Specifically, they used a 1.5 millimeter Dermaroller and did that once a week for 12 weeks, but they treated a tiny little area, a 1 centimeter area of treatment, and they counted the hairs at the end and also asked patients what they thought. What they found was an increase in hair count, but that was significantly greater for the microneedling group compared to the minoxidil group, and so the numbers look quite dramatic. The investigators saw that 40 patients in the microneedling group had a 2 to 3 plus response on a visual scale compared to none of that in the minoxidil group. When they asked patients what they thought, in the microneedling group, 82% of the patients reported more than 50% improvement compared to minoxidil group, which was 2 patients or 4.5%. Other findings that they saw were initiation of new hair growth. It took only 6 weeks for the microneedling group to see some hair growth versus 10 weeks in the minoxidil group. They also noted faster regrowth of existing hair. Patients who failed conventional therapy like minoxidil or finasteride showed improvement with microneedling. For me, this study shows that microneedling was safe, which is the most important thing, but I don't know if it was more effective compared to minoxidil just because of such a short follow-up period. We know that minoxidil itself takes about 4 to 6 months, sometimes even longer, to get the hair to regrow. The other thing is they only treated a 1 centimeter area. I don't know how you can extrapolate that to the entire scalp, because there are some areas that respond better than others, depending on how long their hair loss has been there. If you have areas that are only starting to lose hair versus areas that are balding already, that's going to be very different in terms of response. Could this be something that we can use for patients who are not responding to traditional treatment? Maybe. This next study is a replication of the previous study, but it's more current, published in 2018. They split 60 patients into 2 groups, the control group getting minoxidil and the test group getting minoxidil plus microneedling. They used the Dermaroller of a 1.5 millimeter length, and they went in 3 passes, longitudinally, vertically, and diagonally. And they did it until they achieved pinpoint bleeding. A total of 8 sessions of microneedling, split up as 4 sessions in the first month and 2 sessions in month 2 and 2 sessions in month 3. They did not apply minoxidil on the day of the procedure, and they resumed minoxidil the day after. The results was based on hair count and what the patients thought. What they found was 100% of the patients in the test group had an increase in hair count. Now 24% of the control group who was on minoxidil alone did not have any increase. The average increase in hair count was significantly higher in the test group compared to the control, but the increase in hair count was not statistically significant in those who had received treatment in the past for hair loss versus patients who have never had any treatment at all. That is an interesting finding. They also noted that whatever was gained from microneedling was only preserved if you kept using minoxidil long term. This finding is consistent with treatments for androgenetic alopecia as a whole. You kind of have to keep going no matter what. What this confirmed to me was microneedling is safe, but was it effective? My question here was, does it improve the activity of sulfosyltransferase, which is the enzyme that converts minoxidil into its active form at the hair follicle level? It also sounds like maintenance treatment is critical. My problem with this study was the sample size was rather small, as well as the short follow-up period. The next study looked at how effective are at-home microneedling devices in androgenetic alopecia, published in 2020. They had 29 patients split it into 3 groups. The first group getting microneedling only at a depth of 0.25 millimeters, and they tapped the target area 20 times. Group 2 had microneedling plus minoxidil, and group 3 had minoxidil only. Patients received treatments 2 times a week for 6 months. 6 months is a great follow-up time, and what they looked for was hair count and asked what the patients thought. What they found was that hair count improved the most in the combination group, but it wasn't statistically significant compared to the other 2 groups. And when they asked the patients what they thought, the combination group did a lot better, but again, not statistically significant between the other groups. For me, what that shows is microneedling again is safe, but here they demonstrated that it wasn't really effective. Now I'm drawing some skepticism here as far as the results, but my question for this study was, is needle length a factor in efficacy? Because as we recall, for the anatomy of the hair follicle, the bulge where all the stem cells sit is actually 1 to 1.5 millimeters below the depth of the skin. So is 0.25 millimeters too shallow to have an effect? This next study I liked because they used trichoscan to measure their results. And this is a method that I feel you can get the most consistency in counting the hairs as well as measuring objective results. This study looked at using PRP delivered by microneedling versus intradermal point-by-point injection with a syringe. They split 62 patients into 2 groups, 31 patients receiving PRP injected with an insulin syringe and 31 patients receiving microneedling plus the PRP solution delivered by an automated microneedling pen of a 1.5 millimeter depth. They treated once every 2 weeks for 3 sessions and then again in 4 weeks. Both groups received 4 PRP treatments total. They measured hair count, hair density, terminal hair count, which is the thick hairs, and terminal hair density as well. The investigators also did a pull test, which checks to see how much telogen hairs are there. Telogen hairs will fall out more easily versus anagen hairs. These are the hairs that are still growing. They also asked patients what they thought. The results of this study showed that the average hair count and the hair density, including terminal hairs, increased in both groups compared to before treatment. Now the anagen to telogen ratio and the mean hair length was higher in the combination group than PRP alone. The reason for this was they didn't see any change in the number of anagen hairs in the microneedling group, but they saw a decrease in anagen hair in their PRP group. You always want to see more anagen hairs than telogen hairs when you're trying to get some hair growth, because that's what's actually growing the hair. Telogen hairs just kind of sit there. They don't really do much and they eventually fall out. For me, what this study showed was that both treatments were effective. Now, because there were improvements in the combination group, my question is microneedling doing something beyond the effects of growth factors? That's yet to be determined. This next study that I chose I thought was useful because it was a randomized controlled trial and they used a number of different treatments in the study arms. So group 1 had microneedling alone, group 2 had microneedling with minoxidil, group 3 had microneedling with growth factors, and group 4 had everything. They treated the patients once a week for 16 weeks, and they looked at hair count, hair density, the thickness of the hair, a photographic evaluation of the scalp, as well as asking the patients what they thought. The results of the study showed that microneedling by itself was considered no change. For the group that had minoxidil plus microneedling, they saw an increase in hair density as well as hair diameter. Group 3 that had microneedling and growth factors had an increase in density, diameter, but especially follicular unit density. Follicular unit density is how much hair is in one area. The group that had everything had an increase in everything. So it seems here that minoxidil had a better effect on density, and the growth factor had a better effect on the follicular unit density. It also shows to me that combination treatment is promising. Now the sample size was extremely small for all the arms, and 16 weeks, again guys, is a very short time frame to measure any outcome for any hair loss treatment. This next study I chose because I thought it was very interesting in that it assessed the patient clinical outcomes as well as asking the question on a molecular level, what is happening here? So what they did was split 60 patients into 3 groups. The first group getting minoxidil only and using that twice a day for 24 weeks. The second group had microneedling by an automated pen at a 1 to 2 millimeter depth. They got a treatment every 3 weeks for 8 treatments. And then group 3 had both. What they found was that the hair count increased in all the groups, which made sense. The hair density increased in the microneedling pen and the combination group, but more improvement was seen in the combination group versus microneedling or minoxidil alone. They also did PCR analysis. Now PCR is a fancy way of checking DNA signals in the tissue or blood. And what they saw was an upregulation in the Wnt and beta-catenin pathway, which supports what was seen in those rat studies. So what that means to me here is that microneedling again is promising. As it shows, combination therapy is likely better. The next study I chose was the only one I could find that looked at the efficacy of different needle lengths. They split up 60 patients into 3 groups. The control group getting minoxidil only, group 2 getting microneedling at 1.2 millimeter depth and minoxidil, and group 3 got 0.6 millimeter depth. They checked hair count, hair thickness, and what the patients thought. Everybody had improvement, but in group 2 with the 1.2 millimeter depth, hair thickness improved a little bit more, and when you used the 0.6 millimeter depth with minoxidil, you had more improvement in both hair count and hair thickness. So the results of this study was fairly interesting, and it looks like 0.6 depth is possibly more effective than 1.2 depth, and I don't know the answer to that, but from what it seems, longer is not better and is possibly more painful. The downside to this study is that 12 weeks, again, is too short of a duration. I don't understand why they can't just extend these studies for 6 months. That reflects real practical use in our daily lives, as well as gives the minoxidil time to get the hair to regrow, so you can make an accurate comparison between the 2 groups. The last paper I want to talk about was a review paper. They aggregated all the information from the microneedling studies, and they churned out some fancy analysis and drew their own conclusions. So let's see what they found. After screening 79 articles, they ended up with a total of 9 trials that were included in the analysis. So plug that into the system, and then here's what they saw. The true mechanism for which microneedling helps with hair loss is yet to be determined. They also found that microneedling by itself was better than minoxidil by itself. I don't know how that is, but that's interesting. They also found that when you combine microneedling with minoxidil, you get an increase in total hair count that's more significant than if you did microneedling by itself. This could be from the added effects of the minoxidil to stimulate vascular supply, and also helps with the penetration of the medicine deeper into the scalp. So those things may be playing a role here. The other thing that they found was longer duration of microneedling sessions and less frequent sessions had a positive influence in total hair count. However, they didn't qualify how long is longer and how frequent is less frequent. And there you have it, guys. Those are the studies that I had a chance to review, and although they are of lower quality, it doesn't necessarily mean they're all bad. There are probably some kernels of truth that are sprinkled in these studies. We just have to remember to take these results with a grain of salt, because these studies are definitely not perfect. So after all that, here's what I think. Although microneedling appears to be very promising and likely has a place in the treatment algorithm for androgenetic alopecia, there are still plenty of questions to be answered. Where microneedling could possibly be useful is for a patient who's previously not responded to topical minoxidil or finasteride after an adequate trial of about 6 months to 1 year. These patients could consider adding it to their routine to potentially get some additional benefit. Based on some of the results, I'm very curious if it has a positive influence on follicular sulfosyltransferase, which is the enzyme that converts minoxidil to its active form around the hair follicles, or it just boosts growth factor effects, or both. We would need some basic science research to answer this question. One limitation here is that I wish that there was some consistency across the board in these studies so that we could draw some sort of conclusion in terms of how often microneedling should be done, how long to perform each session, do we roll, do we stamp, or do we micropen? What needle length depth is ideal, and what treatment endpoint is good? Should we aim for redness, no redness, bleeding? I mean, as you guys saw in the studies that I presented, it was all over the place. What I can say based on some of this data and just logic is that using a needle length of 0.5 to 1 millimeter is probably the ideal needle length. If you look at the hair anatomy, based on where the bulge is, which is about 1 to 1.5 millimeters below the skin, this is where all the stem cells are, which regenerate the hair and other elements in the skin. Using a longer needle length would probably damage the bulge. I don't want to damage the bulge. The goal is to stimulate the bulge, not destroy it, if you know what I mean. The other caveat is skin on a balding scalp is thinner than on scalp with a whole lot of hair, because there are decrease in follicular size, the gland, and also chronic sun damage, which thins out the skin. Scalp also thins with age as well due to loss of fat and changes in blood circulation, which should probably be taken into consideration when choosing needle length. But I'm just thinking out loud because this is what makes the most sense to me. As far as tolerability, in a controlled setting done by trained professionals, it appears that patients tolerated it very well and only experienced irritation, redness, or transient pain. I can't say it would be the same if you do it at home because there is so much variation in user technique, the tool, sterility, as well as how aggressively it's being done. For the DIY scenario, infection risk is slightly higher, and there's also a higher risk of scarring if it's done incorrectly or too aggressively in the hands of an overly eager person. Just remember, more is not always better. Scarring is obviously bad because it destroys the hair follicle, and then you end up having the opposite effect of what you wanted in the first place. I know there's some of you out there who are probably gonna try it or have been already doing it, but my caution is just to be safe always. With that said, I'll put out a video in the future on how to do microneedling at home if you're going to do it, just to make sure you guys stay safe. Like I mentioned, the Dermaroller is gonna damage some hairs along the way, just based on the mechanics and the rolling action of the needle. You may get less damage by stamping or using the pen because it's going straight down versus rolling and hitting the skin at an odd angle. But the most important thing to remember is all of these devices are single use only, no exceptions. That's all I have for you guys. Thank you so much for watching until the very end. I learned a lot making this video, and thank you to my subscribers who inspired me to make this one. I definitely read all the comments and love all the suggestions and questions. If you like this content and want to see more of this type of stuff, click that subscribe button and the notification bell so you don't miss out on a new video every week. Have a great hair day, y'all, and I'll see you in the next one.